Hello, welcome to my channel. So today we are going to talk about another case study. So this is a case study about a 32-year-old woman with a G3. Uh, with a G3, most likely maybe there was some disparity in typing. So it's supposed to be uh, a G4. So this is a G4. Okay, so this is a G4. Since you can't be uh, since you can't be a G3 power 1 plus 2, so it's most likely this is a G4 power 1 plus 2, who she had two abortions. Okay, then what are you going to ask her about previous pregnancies? Okay, that's one question. Then she has a history of painless dilatation of the cervix and also of pregnancy. What's the diagnosis? Then what are you going to do for her for this pregnancy, and also when? Mention one investigation we are going to do for her. Okay, so this is our case study. So G4 per 1 plus 2 and 2 abortions. And then what are you going to ask her about the previous pregnancy? So age. So how did she first confirm the diagnosis? And also detail of each abortion. So gestation age, was it painful or painless? Any contractions felt? Was there bleeding? Was there rupture of membranes? Was there passing of tissue? Okay. Then also ask about history of surgeries. So history of surgeries such as D and C. Also history of sacrilege. Okay. So sacrilege. Okay. Then this woman had, so this is another question where they say that she has a history of painless dilatation of the cervix. So what's the diagnosis? So this is cervical incompetence. If the history is that she has painless dilatation and also of pregnancy, okay, that's cervical incompetency. Then what are you going to do for her for this pregnancy and also when? Okay, so cervical sacrilege, which is ideally placed at 14 to 16 weeks, but can be done up to 24 weeks. That's what we're going to do for her. Okay, so mention one investigations we are going to do for her. We can do an ultrasound, we can do an eye vaginal swab, and also pap smear. So swab, okay, and a pap smear for, of course, for infections. Okay, so that's basically what we are going to do for this woman. Okay. The under literature review for management of cervical secret by gestation age. So of course you will confirm viability and no fetal anomalies by ultrasound. Okay, so that's during the first trimester. Okay, so during that period you even establish history for cervical incompetency as early as possible. Okay, then for the optimal timing of for cervical sacrilege placements, you can do it at 14 to 16 weeks, or uh, even up to this point, which is most likely the 16th week. That's the optimal timing. Okay, but can even be done up to 24 weeks. But the optimal timing is 14 to 16 weeks. Okay, then after 37th week, after 37 completed weeks, that's when you can remove sacrilege or await spontaneous labor. Okay, or if the labor has started, then of course you remove it. Okay, so those are some of the things which you usually do. Then, but for we have to know about preoperative assessment. So of course ultrasound confirm pregnancy viability and gestation age, and you have to exclude major fetal anomalies and assess for uterine anomalies. So maybe they have, so that is biconjugate uterus and also the myomas. Okay, then you can also do an endocervical swab, which will assess for infection, gonorrhea, chlamydia, and treat any infection and advise the patient to abstain from intercourse for 1 week while partner is treated. Okay. Then you have to review risks with patient. So we have chorioamnionitis, fibrous scarring of the cervix. Then also have to know some common indications for cervical sacrilege, so be it elective or emergency. So we can do cervical sacrilege when someone has 2 or more consecutive prior second trimester pregnant losses, or 3 or more early preterm birth, so less than 14 weeks. So that's when you can do cervical sacrilege. Then these factors for cervical insufficiencies, you can also an indication. So if someone presents with risk factors for cervical insufficiency, then of course you can go ahead and do an elective or an emergency one. Also, you can of course have to exclude infection, placental bleeding, and multiple gestation. Okay, that's what you can actually do. Okay, as an elective. Okay, then postoperative management and cervical sacrilege, of course, immediate care includes antibiotics, analgesia, and spasmodics. Then also have to consider advising, in sexual intercourse for 2 weeks post procedure. Then routine antenatal care visits visits or booking, unless otherwise indicated with repeated counseling. Okay, so of course, reinfection, labor, and prom. Then of course, then if no antenatal problems, then you have to remove the cervical sacrilege as outpatient as the 7th week. But if labor or severe or persistent APH, rupture of membranes, or chorioamnionitis were to start, then of course you just have to remove the sacrilege immediately. That's the end of the literature review, and thank you for watching this case study on cervical incompetence, and see you in the next tutorial.